Hello, I am Dr. Nagaraj Puttaswamy. Laparoscopic appendectomy and post-operative recovery and post-operative care. How early can the patient recover from laparoscopic appendicectomy? See, if it is not very complex appendicitis, feel the patient should recover within a day. That is generally followed. Appendicectomy, if it is very early done, maybe early in the morning. Generally, we don't see patients early in the morning with appendicitis because by the time we make a diagnosis, it will be afternoon or post-evening. So, we operate the patient in the morning. Patient will be able to walk around in the afternoon, leave the hospital in the evening. That quick is the recovery. But many times that doesn't work that way because it is not a planned work. It is acute appendicitis. Patient doesn't know, even the doctor doesn't know. The patient comes with symptoms of pain, abdomen, vomiting and fever. Clinical diagnosis is done, investigations are done, ultrasound is done. Maybe sometimes the patient is subjected for a CT scan or something else. So the diagnosis happens late in the afternoon. Surgery is done in the evening. Maybe the patient, if he is lucky, patient can leave the hospital within the next day morning. But complex surgical procedures, when the perforated appendix is there or a mass in the abdomen related to appendicitis is there, it becomes again a difficult scenario. Whether can we do it laparoscopically? Yes, of course. Even if it is a mass of appendix, we can still be able to perform laparoscopically. But how quickly should we operate? If a patient has suffered with appendicitis or pain abdomen and has symptoms for a week or 10 days time and he has come with a palpable or clinically established mass, should we intervene and operate on those patients? Many a times we try and tell that please don't try and push yourself to operate that mass unless it is an abscess. If it is not an abscess, if it is only an appendicular mass. Appendicular mass is something like a body mechanism which will help the appendix to get covered with the help of omentum, group of small intestine. All this will form a mass so that appendix is not allowed to perforate into the peritoneal cavity. This is a normal physiological change which will happen within the abdominal cavity. So we don't have to push ourselves to explore, try and release the mass and then try to identify the appendix and remove it. So during this process, we may possibly injure the intestine and cause more damage than good to the patient. So we try to restrict that and then treat the patient medically, allow that patient to become relatively fine, put the patient on empty stomach, give IV fluids, give antibiotics, give analgesics and treat the patient, allow the patient to go back home. Maybe interval appendicectomy can be planned after 1.5 months time. This is how we try and handle appendicular mass. What are the other possible complications? Gangrenous appendix can happen, perforated appendix can happen, abscess of appendix can happen. If the appendix is in the retroperitoneal region, in the sense it is many a times behind the cecum, that is the beginning of the large intestine. If it is behind that, then it perforates there. It is not in connection with the abdominal cavity. It is behind the abdominal cavity. It will allow the pus to establish there and a big abscess in the retroperitoneal region can establish. It is very difficult. Patient continues to have pain abdomen, continues to have high grade fever and vomiting. Patient gets very, very acutely sick. These patients need to be intervened and operated. Can that be done laparoscopically? Of course, yes. We can definitely explore the retroperitoneal space, open the line of Toll and try to identify the base of the appendix, disconnect it from the cecum, remove the appendix piecemeal and finally do a thorough lavage after aspirating all the pus within the retroperitoneal space. The appendicular abscess can easily and conveniently be managed laparoscopically. Gangrenous appendix, perforated appendix, yes, it has to be triggered and operated on war footing activity because we have seen a lot of patients getting to acute bacterial peritonitis which is life-threatening. So we need to intervene and jump and operate on these patients as quickly as possible. We would have left behind a drain, we would have put the patient on multiple and high-grade antibiotics to help ourselves so that the patient recovers much quicker. These are complicated scenarios related to what appendicitis would be. How early patient can recover? Say simple appendix very quickly within a day or two, and complex surgeries invariably, as I try to tell, it within the hospital it may take about 2-3 days or maybe a week's time. And following that, we will advise the patient to be restrictive. But once if the surgery is performed laparoscopically, maximum activity or recovery period would be about a week or 10 days time. I don't think the patient need to restrict himself or herself to bed for beyond that time. If it is failed laparoscopic surgical procedure, if we have to convert that surgery because of reasons unknown, maybe something like intestine is also affected badly, we have to do a resection of intestine, repair or a re-anastomosis, that sort of scenario, we may try and convert that laparoscopy into open surgery. This may extend the duration of stay in the hospital, and also recovery period becomes very, very lengthy. We don't see patients very often with this scenario. And related to post-operative management of patient, it is a relatively straightforward appendix. I don't think there is much to do within the hospital or even after the recovery going back home. Dietary changes are almost not there, maybe first week or so, just because we are trying to handle infective condition. We try to be very subtle on dietary activity. I try to usually suggest a vegetarian type food, relatively bland type of food, more of liquid type of food. So if it is practice for about 5 days to 10 days, probably the patient will be perfectly okay. Patient can go back to normal eating habit after that. Physically, how quickly the patient can go back to normal physical activities is maybe about 10 days, 15 days time. The patient can perform everything and all the physical activities the patient was performing normally before the surgical procedure. This is what I can say and sum up about appendicitis and its related complications. Is there a long-term pain and a discomfort following appendicitis and appendectomy? And also digestive problem, is there a possibility related to appendix surgery? I don't think there should be something like this. Once appendix is removed at the base correctly, I don't think there should be anything left behind. The patient can eat normally, no digestive discomforts would be there. There is absolutely no reason for the patient to have long-term pain. But in case if there is a subtotal removal of resection, there is a condition called stump appendicitis. Stump in the sense, say for example, appendix is a little finger sized. You just have to imagine, if it is not ligated at the base, if it is ligated little distally or away from the base, and the base of the appendix can get infected, that is called stump appendicitis. So in that condition, the patient can present similar to what appendicitis would be there. And maybe have, as a question comes up, saying that the patient can have a long-term small discomfort or a vague pain in the abdominal cavity, or a patient has digestive discomforts because of the infective status, where the patient may have frequent loose stools, mucus discharge, sometimes blood in stools. All this would be there just because of this condition. Otherwise, if the appendicectomy is performed rightly and if it is performed till the base of the appendix, I don't think there should be any reason for long-term pain and digestive disorder.